Coca-Cola had cocaine. Bayer sold heroin to children. Then America spent 50 years arresting people for the same drugs, until corporations and governments figured out how to profit again. Here are the 7 ways drug laws were always about money, not health. Reason number 1, hemp threatened corporate profits, so they banned all cannabis. Alright, reason number 1, cannabis was criminalized because it competed with nylon and newspaper profits. I'm not kidding. Here's what happened. In the 1930s, hemp, which is cannabis without the psychoactive stuff, was on track to become a major industrial crop. You could make paper, textiles, rope, and building materials from it. It was cheaper and more sustainable than existing options. 2 problems. DuPont had just invented nylon and wanted to dominate the synthetic fiber market, and William Randolph Hearst owned massive timber investments for his newspaper empire. Hemp threatened both industries. So what did they do? They funded a propaganda campaign to criminalize all cannabis, even the non-psychoactive hemp. Enter Harry Anslinger, head of the Federal Bureau of Narcotics, who ran a campaign so absurd it makes modern conspiracy theories look subtle. We're talking reefer madness. Literally a film claiming marijuana turns people into violent maniacs. The entire campaign was funded by corporate interests who wanted hemp gone, and it worked. The Marijuana Tax Act of 1937 effectively killed the hemp industry. Fast forward to 2018. The Farm Bill re-legalizes hemp. Why? Because corporations figured out they could make billions from CBD products. Suddenly hemp isn't dangerous anymore. So to recap, we destroyed an entire industry because it competed with nylon. Nylon, the fabric that makes your shirt cling to you when it's humid. That nylon. Reason number 2, cocaine was in Coca-Cola until they couldn't tax it. Reason number 2, cocaine was totally legal and in your soda until the government realized they couldn't control or tax street sales. From 1886 to 1903, Coca-Cola contained about 9 milligrams of cocaine per glass. You could buy it at any soda fountain. It was marketed as a health tonic. Coca-Cola, delicious and refreshing. Also mildly addictive, but hey, details. Cocaine was everywhere. It was in tonics, wines, medicinal elixirs. You could buy it at the pharmacy. Totally legal, totally unregulated. But here's the problem. The government had no way to regulate or tax it. Anyone could sell cocaine. No permits, no licenses, no revenue stream for the government. So in 1906, the Pure Food and Drug Act started requiring labels. Then in 1914, the Harrison Narcotics Tax Act effectively criminalized cocaine unless you were a doctor or pharmacist, because those could be regulated and taxed. Notice the pattern. Cocaine was fine when it was in Coca-Cola and sold through regulated channels, but once people started selling it independently, illegal. And here's the kicker. Cocaine is still legal today. Hospitals use it. It's a Schedule II drug, which means accepted medical use. You just can't buy it on the street because the government can't tax that. So cocaine in your soda, fine. Cocaine in your pocket, prison. The difference? Tax revenue. Reason number 3, Bayer marketed heroin as safe cough medicine for children. Reason number 3, Bayer, yes, the aspirin company, trademarked heroin and marketed it to children as a safe, non-addictive cough suppressant. In 1898, Bayer synthesized diacetylmorphine and trademarked it under the name heroin. They marketed it as a safer alternative to morphine. It was sold over the counter for coughs, colds, and pain. They specifically advertised it for children. Bayer heroin, safe for kids. Spoiler alert, it was not safe for kids. Turns out heroin is extremely addictive. Who could have seen that coming? Certainly not Bayer, apparently. By the 1920s, the addiction crisis was undeniable. So in 1924, heroin was banned in the United States. Totally illegal. You can't have it. It's too dangerous. Except here's the thing. Morphine, oxycodone, hydrocodone, and fentanyl are all still legal with a prescription. They're chemically similar to heroin. Some are even stronger. The difference? Pharmaceutical companies can patent, regulate, and profit from those. Heroin, no patent, no control, no profit for corporations. So heroin sold by Bayer to children. Heroin was fine when Bayer sold it. Heroin sold by some guy on a street corner? Life sentence. The logic is flawless. Truly. Reason number 4, psychedelics were banned because nature can't be patented. Reason number 4, psychedelics showed incredible promise for treating mental health. So naturally, we banned all research for 50 years. In the 1950s and 60s, LSD, psilocybin, and MDMA were being studied legally. Over 1,000 clinical studies were published. The results were promising: PTSD treatment, addiction therapy, end-of-life anxiety relief. But here's the problem. Psilocybin is a mushroom. LSD is derived from ergot fungus. MDMA was synthesized but not patented. These are natural or easily synthesized compounds. You can't patent nature. And if you can't patent it, pharmaceutical companies can't monopolize it. If they can't monopolize it, there's no profit incentive. So in 1970, the Controlled Substances Act classified psychedelics as Schedule Y. No accepted medical use, high potential for abuse. Research shut down. Funding disappeared. 50 years of silence. Fast forward to now. The FDA is fast-tracking psilocybin and MDMA for therapy. Why the sudden change? Because pharmaceutical companies figured out how to synthesize patented versions. Suddenly, psychedelics have medical potential again. What changed? The ability to profit from them. So let me get this straight. Psychedelics were too dangerous to study, but now that pharma can patent synthesized versions, they're medicine again. Cool, very scientific. Reason number 5, the war on drugs built a $5 billion prison industry. Reason number 5, America built a prison industry that profits from drug offenses, then kept drugs illegal to keep the industry running. In the 1980s, Ronald Reagan launched the war on drugs. Mandatory minimum sentences for drug offenses exploded. Possession of 5 grams of crack, 5 years minimum. Possession of 500 grams of powder cocaine, same sentence. The result? Incarceration rates skyrocketed. By 2020, drug offenses accounted for 46% of federal inmates. And here's where it gets profitable. Private prisons. Companies like CoreCivic and GEO Group run prisons for profit. States pay them per inmate, anywhere from $30,000 to $60,000 per year per person. The private prison industry is worth about $5 billion annually, and a huge chunk of that comes from drug offenses. Now here's the best part. Prison labor. The 13th Amendment bans slavery except as punishment for a crime, so prisoners can be forced to work for pennies per hour. Legal slavery, with a loophole. Corporations profit from cheap prison labor. Private prisons profit from incarceration. The system is designed to keep people locked up. But then something changed. States started realizing that taxing legal marijuana generates more revenue than incarcerating people for it. Colorado made over $400 million in marijuana tax revenue in 2022. That's more profitable than paying private prisons to lock people up. So what happened? States started legalizing. Not because marijuana is safe. It's always been relatively safe, but because the profit model shifted. We built an entire industry around locking people up, then realized taxes paid better, so we started letting them out. Reason number 6, Big Pharma's legal drugs are objectively worse. Reason number 6, pharmaceutical companies caused the worst drug epidemic in American history with legal drugs and faced almost no consequences. Let's compare. Marijuana, federally illegal, 0 overdose deaths in recorded history. You literally cannot consume enough marijuana to die from it. Now let's look at legal drugs. OxyContin, Purdue Pharma aggressively marketed it as non-addictive despite knowing it was highly addictive. Result, over 500,000 opioid overdose deaths since 1999. Purdue Pharma made $35 billion in revenue. They paid an $8 billion fine. That's like robbing a bank and keeping 80% of the money. Adderall, it's literally amphetamine. We prescribe it to children for ADHD. It's chemically similar to methamphetamine, but it's fine because Shire Pharmaceuticals has a patent. Xanax, benzodiazepine, highly addictive, causes severe withdrawal. Totally legal with a prescription. Pfizer made billions. Fentanyl, 50 times stronger than heroin, prescribed legally, also the leading cause of overdose deaths in America. So just to be clear, marijuana is Schedule I, no accepted medical use, highly dangerous. OxyContin, which killed 500,000 people, is Schedule II, accepted medical use, available by prescription. The difference: Pfizer and Purdue can lobby Congress. Marijuana dealers cannot. Big Pharma can cause an opioid epidemic, pay a fine, and keep operating. But if you're caught selling weed, prison. Reason number 7, states legalized weed once they realized tax revenue. Reason number 7, marijuana was a dangerous gateway drug until states realized they could tax it. Then it became medicine. For 50 years, marijuana was the ultimate villain. Politicians called it a gateway drug. If you smoke marijuana, you'll end up on heroin. Public service announcements showed eggs in a frying pan. This is your brain on drugs. The federal government classified it as Schedule 1, more dangerous than cocaine, meth, or fentanyl. But in 2012, something changed. Colorado and Washington legalized recreational marijuana. Why? Tax revenue. Colorado made $423 million in marijuana tax revenue in 2022. Washington made $559 million. California, over $1 billion. Suddenly, states that spent decades locking people up for marijuana possession started releasing them. Not because marijuana is safe, it's always been relatively safe, but because locking people up costs money and taxing legal sales makes money. Governors who campaigned on tough on crime started cutting ribbons at dispensary openings. Sheriffs who spent careers arresting people for possession started posing for photos with legal grow operations. The same politicians who screamed gateway drug are now talking about tax revenue streams. And here's the punchline. Marijuana is still federally illegal. The federal government won't legalize it because they haven't figured out how to control interstate commerce and banking regulations for it yet. So it's legal in 24 states, illegal federally, and the only reason it's not legal everywhere is that Congress can't agree on how to tax it properly. It was never about danger. It was never about public health. It was always about who gets to profit. So there you have it. Hemp was banned to protect nylon profits. Cocaine was criminalized once the government couldn't tax it. Heroin was fine when buyers sold it. Psychedelics were banned because you can't patent mushrooms. We built a prison industry that profits from drug offenses. Big Pharma's legal drugs killed 500,000 people, and states legalized marijuana once they realized tax revenue. 7 reasons American drug laws were always about money, not health. If you love exposés on how American industries and governments prioritize profit over people, hit subscribe. We've got plenty more corporate scams to unpack because capitalism never met a moral panic it couldn't monetize.